Welcome, I'm Tammy Duquette. I am the Associate Executive Director here at JDRF, and I've got a couple of friends joining me that I will be introducing you to. But first, I just have a couple of things that I want to tell you about. If I can get my screen to work, there we go. Our JDRF Type 1 Nation Summit. So nationally, they are putting on a virtual summit on September 26th. And if you go to jdrf.org and type in summit, you'll be able to find the link to it. But if you also go to our Facebook page, you can find it as well, or you can respond to the emails that you've gotten about this webinar, and we can send you the link as well. This is a great time for learning. They've geared a few of the workshops specifically to young adults, and they consider young adults 18 to 30. And they even have, with Beyond Type 1, a young adult cocktail hour, the night, or not really cocktail hour, but party hour, whatever you want to call it. The night before Friday night, they're going to play some games and have some fun. But then they have some topics specifically geared towards young adults. And then of course they have adult topics and topics about your children. So I highly recommend going online and finding out about that and registering for it, because you do have to register, and it's going to be on Zoom like you have here, but there's going to be breakout rooms because you're going to be able to pick what you want to take. There's several different things to be able to take, and I think it's going to be really good. And we have our JDRF One Walk coming up, but this year, because we can't really all walk safely together, we've turned it into a car parade. It is going to be so much fun. We're going to have even a radio signal that you can tune to in your car. So as the DJ's playing music, you'll be able to hear it, and you'll be able to hear us talking. We're giving out a special commemorative bandana to all the cars. And the idea is that you decorate your car and you show up with your family. You're going to stay in your car through the entire thing. It's going to be short. It's not going to be too long. But you get to be in the parade, and at the end, you get to drive through the big blue arch that you normally walk through. If you're new to us, you just go to walk.jdrf.org and you can register. And again, if you even go to jdrf.org, you'd be able to find it. And I hope that you join us. If you aren't able to join us, there is a JDRF National Walk Day on November 1st. And between now and November 1st, JDRF is trying to get our whole T1D community to come together and walk 1.6 million miles for the 1.6 million Americans with type 1 diabetes. So there is a way that you can use the Strava app, and as you put in your walking, your steps, you can have it go to JDRF, to the leaderboard, and we collectively keep all of our miles. And then on November 1st, you all come together for a great online celebration. And even if you're participating in our walks, we are using this as a celebration at the end of our walk season. So I hope that you're able to join us, or if you live too far from where one of our walks are, this is a great way to be a part of the One Walk community for you and your kids. And with that, I'm going to introduce you to Jeremy Hudson. He is a representative from Xeris Pharmaceuticals. He is going to be filling you in on some great information today, but he's first here, and I could give you a little bit about him. Jeremy is a registered dietitian nutritionist. He's got 6+ years in pediatric nutrition and diabetes, and he has both T1D and type 2 diabetes in his families, and his passion is helping others, and he can certainly do it through this job. He and I have had several conversations since he started with Xeris, and I can tell you that he is passionate about helping you, and I think you're really going to like what he has to tell you today. But his first job is to introduce Terri to us.
Yes, Tammy, thank you very much. We, welcome everybody. We couldn't be more excited to have you with us. Very excited to introduce you to Terri, who is comes with a ton of experience. So Terri has over 20 years of experience in school and community health as a registered nurse and a health educator. She is a certified ACE master trainer with the Michigan ACE initiative, which is actually ACE stands for Adverse Childhood Experiences. So she has a great passion for really supporting the community within the whole state of Michigan because she serves as the president of the Michigan Association of School Nurses. So without further ado, I will pass it along to Terri.
Okay, thank you, Jeremy, and thank you, Tammy, for the invitation to come today, actually both of you. I'm going to go ahead and pull up my PowerPoint here and get this started. There'll be a little bit of a delay here. Okay. And there we have it. All right, so get rid of that screen. All right, so we are talking about supporting students with diabetes at school. We primarily are talking about, obviously, students with type 1 diabetes and what needs to happen in school so that students remain safe, and what kind of roles and responsibilities exist with the different personnel that would be involved. So just some quick learning objectives. We're going to cover very briefly a couple of federal laws that help to protect students with diabetes. We're going to talk about Michigan laws, some policies that exist in Michigan, and what best practices are for care of students in the school setting that have type 1 diabetes. We're going to talk about recommendations for 504 plans and IEPs, and then, as I mentioned, roles and responsibilities of the different people involved to help make sure that our kids with type 1 diabetes remain safe and have the same opportunities that their peers have. So, school planning. So obviously, we want to make sure, as I already mentioned, that we have a safe environment for all of our kids with diabetes. We want them to have equal access to all of the academic opportunities that exist in the school setting, but also the non-academic, the extracurricular activities, same opportunities as their peers that do not have type 1 diabetes. And then we also want to make sure that we, as a group of adults that support students, are doing our very best to help them transition into independent care. The federal laws that we'll talk about, Section 504, the Americans with Disabilities Act, and then IDEA, all really focus on making sure that kids have equal access. The Section 504 is primarily focused on academic accommodations that are necessary for students to have an even playing field, that they have, as I mentioned, equal access to all academic and extracurricular activities. And then the IDEA and the ADA really are focusing on making sure that there is no discrimination. And that exists for any school that is accepting federal funding, that protect against discrimination. The access to extracurriculars and academics includes the related aids and services that help to make sure that students have an opportunity to reach their optimal potential. So just that quick overview of what exists at the federal level, and now we'll focus a little bit on what happens at the state level. So in Michigan, we have some laws that specifically speak to what must happen for students that have chronic health conditions. So we have a handout. Actually, Tammy will send this to all the participants if she hasn't already. The front page of this handout really is focusing on the need for all schools to have a minimum of 4 people in each school building that are trained in just foundational support of any student with any health or medication need. So that basic foundational training talks about the laws in Michigan. How do we store medications? We focus on privacy and confidentiality, a variety of issues. but that doesn't really cover the student-specific needs of students that have type 1 diabetes. So the inside of this handout that you will receive is a flow chart. The top portion, which is the top page of this handout, is talking about everything that needs to happen before school staff can start providing care to a student with a chronic health condition. And obviously, we're going to focus on type 1 diabetes for all of this conversation. So once a school staff member is aware of the fact that a student has type 1 diabetes, they need to make sure that they have the appropriate documentation that allows them to provide care to a student. So once the appropriate documentation, which is typically referred to as a diabetes medical management plan and a medication administration authorization form, is provided to the school by the parent, the building administrator identifies a group of people that will be supporting that student according to the orders that are received on these two documents, the medical management plan and the medication authorization form. The group of people that have been identified need to receive training from a registered nurse, a physician, or a physician's assistant that is knowledgeable about school health law, and they need to receive not just training in terms of knowledge, but also skill-based training, so hands-on practice with the tasks that they're being asked to do to support the student with type 1 diabetes. Parents are always invited to be part of this training because they know their child best and they can share information that will help the school best support their child. Once the training is complete, everybody understands their roles, they've demonstrated competency, all of the appropriate permissions are in place, that's when school staff can actually begin providing support to a student with type 1 diabetes. Now we know at this time of the year, at the start of the school year, it can take a little bit of time to accomplish everything that is in the top portion of this flow chart. We know that our providers are busy creating diabetes medical management plans for many of their patients. We know that schools are busy trying to identify staff that can support students, and we know our families have busy schedules. So coordinating that training can be challenging at this time of the year, and it may take 3 weeks or so to get everything in this top portion of the flow chart completed. During that time, we want parents to understand that we want their kids at school. What we'll ask though is that the family arrange for routine care that's needed typically at the lunch hour for their child until everything in the top portion of this flow chart is completed. We still have, and I'm sad to share this, we still have parents that are told by schools, we don't do diabetes here. I receive calls from parents asking, you know, what am I supposed to do? And obviously it's important that everybody knows that there's not a school that is accepting any form of federal funding that can tell you that they don't do diabetes. So sharing this flow chart and making sure that parents have an understanding of what their rights are and what schools must do to accommodate the health needs of their child is really important.
Hey, Terry.
Yeah.
Can I ask a question? If there's a district nurse that doesn't allow parents at any trainings, what would your advice or what could that look like?
So that to me is completely unacceptable. The parent offers such an important perspective. To me, there's not a reason for a parent not to be invited to a student-specific training. That training is about their child and about their needs. So I guess I would ask the nurse to help me understand why it wouldn't be important for me to be there.
Great, thank you.
Okay. So the bottom portion of this flow chart really is talking about what the school does once they are able to start supporting the student with diabetes. And really this bottom portion includes making sure that they are maintaining privacy and confidentiality, that they have individual charting documentation for each individual student, that they're not doing things on a group log, that they are well aware of and documenting the student responses to care, and anytime the response to care looks different than what is expected, that they understand the protocols to follow, both for a non-emergent unexpected response to care and an emergent response to care. So making sure they understand the protocol for 911, making sure that they are an integral part of maintaining open communication between the parent, the student, the healthcare provider, and the school staff that's in place to support the student. And then making sure that at the toward the end of each school year, the parents have the information that they need to get medical management plans and medication authorization forms updated over the summer, and that training, new training at the start of the school year can be arranged. The training, the documentation are only ever good for the current school year. So even if we had a student that was diagnosed with diabetes in May, we would go through the process of identifying the team, getting the training done, and then beginning to provide care. We have to repeat that at the start of each school year. And the reason for that is that so much can change. Kids grow, they may change with all of the technology that we have, they may change what they're using to manage their diabetes, and school staff needs that regular ongoing training. There's a flow chart on this document that we're talking about that gives you information about what the different abbreviations are. Designated school personnel is a term that is in the state law, and that covers both registered nurses that work for the school and unlicensed people that are trained by the registered nurses to support students. The other abbreviations are self-explanatory. And then I already mentioned this idea about timely completion. So we all have an obligation to move through this flow chart as quickly as possible. That means the parents in getting us the documentation that we need, the school staff in identifying the team and providing the training, and the provider in writing the orders in the first place. So Tammy has a quick poll that you're going to take here before we go any further.
There you go. You guys can answer the poll right there. And while we're waiting, Terry, Kelly's been letting us know of a problem she's been having with Northville High School and nobody being trained. So I told her I'm going to send you her information after for you to work with her on the problem, because she's been having a really hard time with the school for her child.
Yep, that's fine. And so while they're answering this, I do regularly provide support, certainly within Wayne County. And then as the president of Michigan Association of School Nurses, definitely will respond to requests that we get statewide. But I would like everybody to know that we also have a state school nurse consultant. Her name is Evelia Jankowski, and Tammy will share her contact information with you also. You can reach out to her if you're in a part of the state that is not in southeastern Michigan, and also reach out to the Michigan Association of School Nurses. In Wayne County, you definitely can reach out to me directly.
All right, and I will be sharing that information. Just so you know, her handout, the information she just told you, I have all of that, and I'm going to be sending out a link to the recording of this call as well. So all of that's going to come out to you tomorrow. And I'm going to show you the results. 89% of you provide a new updated medical management plan to your schools.
That's great. Yep, that's great that we have so many parents that totally understand that that is an important thing for schools to have. So the written plan, so the Diabetes Medical Management Plan, is the primary plan that drives care at school. Within that plan are emergency care plans for both low blood sugar treatment and high blood sugar treatment. There also might be an individualized healthcare plan. That really is a nursing document, and that may not be something that you're aware of. If there's not a nurse in the district that your child goes to, then you probably have never even heard of that. And then the 504 plan, as I mentioned, is the plan that is where academic accommodations are identified. And then the individual education plan is the special education plan. If a child with diabetes qualifies for special education, it would be, if it's solely for type 1 diabetes, it would be otherwise health impaired would be the certification. But typically, if diabetes, type 1 diabetes is the only health condition that a student has, they're not likely to have an IEP. They're not likely to be receiving special education services. On a rare occasion, we see some complex needs, but there's typically other health conditions or learning barriers in place. Within the DMMP, that's where really all of the information about routine care, contact information, who is the team that's trained to support the student, all of that information lives in the DMMP. And this plan is implemented collaboratively by that team of people at school that have been trained to support the student. Things like the level of self-care, so how independent is your child? When is blood sugar going to be checked? When is insulin going to be administered? What form of glucagon do they have? And I'm excited that Jeremy's going to be sharing some information about the new Gvoke HypoPen. I'm so thrilled to have that, especially in this virtual world that we're living in, because it's a really easy glucagon administration training to provide to schools. Snacks and meals, what kind of physical activity or sports is the student involved in? All of that information lives in the diabetes medical management plan. The emergency care plans I mentioned are typically part of this plan. They are typically embedded right in the plan, but if they are not, you definitely need to make sure that an emergency care plan for both low blood sugar and high blood sugar is not only provided to the school, but school staff is trained on how to implement those pieces. And in terms of implementation, every school should have a medical emergency response team. That's what MERT stands for. And this is another handout that Tammy will share with you. It covers basic things like, what do we do when we call 911? How do we make sure that the correct information is being shared with EMS so that they know where to come, they know what the emergency is, they know what supplies we have on hand. And then staff, in addition to making sure that 911 has been called, would make sure that they follow the protocols in their district for notifying central office, getting the supplies to the area where the emergency is occurring. So in the case of type 1 diabetes, we would make sure typically we would be dealing with a low blood sugar. So we would make sure that the glucagon gets to the student, that people that are trained on how to administer it and then support the aftercare are present, and that the parents are contacted, the parents are met at the parking lot to be brought into the school so that both the student and the parents are receiving appropriate levels of care. All of the things that need to happen so that even in an emergency situation, the student remains safe. And then schools would also, as part of the medical emergency response, conduct a debriefing session after the fact to make sure that they had all of the supplies that they needed, that they've notified the parents of what supplies need to be replaced, that they feel like they have good communication, training was effective, and if it wasn't, refresher training and all of that takes place. So debriefing is a really important part of the medical emergency response protocol.
Hey, Terry.
Yes.
We had two quick questions that I'd like to kind of throw in right here if I could. First was, do you suggest doing a management plan for a child in private school?
Absolutely. Every single student that has type 1 diabetes, regardless of where they're receiving their education, should have a plan, and the adults that are in the environment where they're receiving their education should be trained to implement that plan. It's all about student safety.
Great, great. And then one more. If it takes weeks to complete the training with the school and school nurses aren't in the county, who's responsible for that child while at school should an emergency happen? For example, need for glucagon, or not just helping with counting carbs at lunch, but all the other hours, busing, etc.
So we really try to move through that process of having trained individuals ready to implement the plan as quickly as possible. But as we're working through that process, that MERT team that I talked about, schools should have that in place, and they should know, they should be trained in the basic medical emergency response protocol. So in the step of calling 911, they would share that this child has diabetes, that we only have people currently trained in basic, first aid and CPR AED response. We don't have anybody trained to administer glucagon. The parent has been called. We do have the glucagon here on site if, EMS is able to administer it when they get there. All of those sorts of things should be part of what a medical emergency response team is already prepared to handle. Even though they haven't had student-specific training, they should know enough and be trained enough to keep that child safe until EMS and or the parent can arrive. Does that help to answer that?
We will find out, but I believe so.
Okay. All right. So Michigan has, especially in southeastern Michigan, we have a number of health systems that have endocrinology practices that see our students. And we have a number of plans that get provided to the schools. In some cases, we have worked with 5 different types of diabetes medical management plans in one school. So the staff that are trained to support students, most of the time they're unlicensed and they only know what we've trained them on with regard to type 1 diabetes. So for that reason and for a few other reasons that revolve around state law, there was a group that was pulled together at the state level to do some work around supporting students in diabetes. And this work is about a year old, but one of the outcomes of this work was this idea of using a standardized diabetes medical management plan. And so I'm excited to say that we are right now in the pilot phase of the document that you see on the screen. So the first 2 pages of this document, which I know you can't really read here, but they cover, information about the student, and then routine management is on the first page, which covers when are we checking glucose levels and when is insulin administered. It also covers the level of independence that the student has in performing these tasks. The second page outlines what medications are used. So we identify the type of insulin, the route of insulin administration, and then what is ordered for the low blood sugar, the severe low blood sugar treatment. And because this is a new form, right on there, we have the new Gvoke HypoPen. And again, I'm excited about that. And I'm hoping that we'll start to see that pop up in our schools in relative short order here. The third and fourth page outline the emergency protocol for low blood sugar and high blood sugar. So the column on the right of each of those pages covers mild to moderate, high and low glucose levels. And then the right side covers the emergency steps for high and low glucose levels. And then the last page covers all of the things that are very student specific. When is the snack time? What level of independence does the student have in terms of managing special occasions at school that involve food? What is their ability to travel through the school? Do they always have to travel with another person? Can that be a student? Does it need to be an adult, or can they travel alone so long as they're feeling well? It covers the guidance on field trips, you know, that when parents are not able to go or choose not to go, because there's no requirement for a parent to go on a field trip, not for a student without diabetes, nor for a student with. What are we going to make sure happens? And what happens and what must happen is that that student receives the same level of support on that field trip as they do in the regular school setting. How are we going to share documentation? All of that is covered on this last page. And then the bottom of the last page identifies the people that have been trained to support the student and who has provided the training. Jeremy.
Yes, you saw me pop back up on camera.
Yeah.
You know what's coming. So somebody had asked, do you have a standard DMMP form for Ohio?
So no, we don't here in Michigan, but I can tell you that if you are interested in taking this form and adapting it for use in Ohio, by all means, we'd be happy to share it. The laws are different from state to state, and so you would need to modify it, but this could be a good starting point.
Is there, and I will ask this as a follow-up, is there possibly somebody or a resource or somebody that we could point them in a direction to reach out to within Ohio? Because the JDRF group here does Michigan and Northern Ohio. Is there a school nurse in Ohio that we could possibly?
I'm going to say that would probably be a question for Tammy if she has any kind.
Yep, I'm here. And yes, I will look into it tomorrow. I will make some calls and find that out, because we definitely do need a resource for Ohio also. So I will look into that tomorrow. I've already written it in my notes.
Great. Thank you.
Yeah.
And, you know, as I'm thinking out loud here, Tammy, if you are not successful in finding a resource, let me know, and I can always connect you with the president of the Ohio Association of School Nurses.
That would be great. That would be great anyway to make that connection, because we
Sure.
just brought Cleveland into the fold with us. Now we have all of Northern Ohio. So I want to make
Gotcha.
sure I support them well.
Okay.
Thank you, Terry.
You're welcome. So you see all of the information that is included on the diabetes medical management plan is all of that stuff that's important to address the health needs of a student with type 1 diabetes. The 504 plan really should come after the diabetes medical management plan has been received, training has occurred, and it is being effectively implemented. Because it's only at that point that we can really identify what the academic needs of especially a newly diagnosed student with type 1 diabetes. But this is a broader accommodation plan that oftentimes we have parents walk into the school with a pre-printed plan, and that plan we have seen to be multiple pages. And a lot of the content in the plans that come in tend to be content that really belongs in the health plan, so in the DMMP. The problem with having a duplication of information in the 504 is that school staff get confused about, first, what plan they should follow, and then really and truly, if we give them two plans that have duplicate information, they often end up reading not the most important things. So we try to make sure that we're concise with the information, that we provide appropriate training, and that there isn't a duplication. That way they view everything as important to read, and we have a better chance of everything being implemented appropriately. In terms of health information being mentioned in the 504, it really should consist of a statement, you know, if they're talking about testing, needing, you know, extra time for testing when high or low blood sugars occur, it should just say, follow protocol for treating a high or low blood sugar as identified in the DMMP, instead of listing everything that needs to be done to treat a high or a low glucose level. Really, it should be just a reference back to the diabetes medical management plan. Things that are appropriate to be in there are, you know, things that absolutely are connected to access, to programming, services, accommodations around attendance, if those accommodations don't already exist for all students. Because if there's a policy for any accommodation that exists for all students, then it doesn't need to be repeated in the 504. And things that have to do with testing. Most all of the other stuff is going to belong in the diabetes medical management plan. And then for the IEP, I mentioned that there are very few students that have special education services related specifically to their diabetes. If they do have another certification where they're receiving special education services, say for a learning disability, we always recommend that the diabetes is mentioned, but that the plan itself is listed and included as an addendum, as an attachment. We don't want the diabetes medical management plan embedded into the IEP itself, unless the IEP is specifically for otherwise health impairment around the diabetes, because otherwise, each time we change the plan, which for many students, that plan changes multiple times during the school year, it would require opening the IEP to make modifications to it. This way, if there's an IEP that exists, diabetes is identified, it says that the DMMP is an attachment, we can change that DMMP as necessary without ever opening the IEP. So, roles and responsibilities.
Terry?
Yep.
I'm going to interrupt you again. So Sandy had shared that the American Diabetes Association has a DMMP, and then a question came through: are public schools able to follow, in quotes, a student's blood glucose numbers on a Dexcom application, for instance? We were told that there was a legal issue that bars them from doing so.
So, you're going to hear different opinions on that. We do prefer, when we're doing training, that school staff does not download those applications onto their personal cell phones or iPads. When this technology really started to be used, in full force, we had a lot of school staff that were really excited about being able to so closely monitor students, but then they started getting alarms and such after hours on the weekends. And there's a concern about liability, especially if the student isn't with the parents and a school staff member is getting a notification and they have no idea where the student is, and how they would be able to help. So we really do recommend that school staff do not download that stuff onto their personal devices. I know that school staff often wants to help and be as involved as possible, but it doesn't really make sense for a lot of reasons.
Great. Thank you.
Mm-hmm. So roles and responsibilities, we're going to talk briefly about school administrators, the school nurse, designated school personnel, parent, guardian, and student roles and responsibilities. So a lot of this there'll be a little bit of general information, but most of it is very diabetes specific. So for school administrators, the state law in Michigan talks about school administrators being the people that are responsible for designating school personnel to administer medications and support health needs of students. So because the school administrator is the designating body, it's important for them to be knowledgeable about diabetes and to identify a team of people that he thinks is capable of safely supporting a student. And capable includes making sure that those individuals that are identified have an appropriate amount of uninterrupted time to safely support students. The administrators should be meeting with parents and students at the beginning of the school year, making sure that there's a plan in place, that staff has been trained, that all staff has at a minimum awareness training, and that smaller group of staff that is identified to provide routine daily care and emergency care has been identified and has received training. They also talk with the parent and the student about their preferences around glucose level checking and insulin administration sites. Where is that going to happen in the school? And that largely should be left up to the preference of the student. We occasionally still have some schools that say, oh, this all needs to happen in the school office. We can't have students walking around with needles and they can't carry their supplies, but we work really hard to help our school administrators and all other school staff understand the importance of fostering independence with our students with diabetes at a pace that's appropriate for that student. And that includes allowing them to carry all of their supplies if that's what the mom, the parents, and the student are ready for, and receiving treatment in a space that the student is comfortable in. We want to make sure that the emergency system that I mentioned earlier is set up, and that if a student is questioned about anything that they're doing to care for themselves with regard to diabetes, that they understand what their response needs to be to a staff member should they be questioned about what they're carrying, what they're doing. If there are disagreements, the building administrator should be working hard to come up with compromises or appropriate accommodations that provide the level of comfort necessary for that student to thrive in that setting. When there is a school nurse that is part of a school setting, they are involved in coordinating all of the care around the student with diabetes. While they may not be the person directly providing that care, they do coordinate and provide the training that I mentioned earlier. They are often the person that would be the contact person between the school, the family, and the healthcare provider to make sure that expectations are clear, that there is accurate and current information on file about what the student needs in terms of support at school.
Terry?
Yes.
I'll give you room to cough. I'm going to give you like a 5-minute warning so that we can give Jeremy some time at the end.
Yep.
Okay, we're about good with that? Okay.
Yep, I am. Okay. So in terms of the school nurse, they also are an advocate for that student. They try to make sure that there is a safe situation for receiving care at school, and definitely provide advocacy to the student and the family to safeguard the necessary accommodations. I mentioned communication already. The student's prescriber, that is the person that would be making sure that a current medical administration or medication administration authorization form is provided for the glucagon and for the insulin, and that a current diabetes medical management plan is completed. They should be identifying signs or side effects of medications that are ordered, and identify whether the student can self-carry and self-administer medications, primarily the insulin. For the designated school personnel, they have to follow policy and procedure and follow the training that they have received in terms of supporting the student with diabetes. I think one of the most important things to say here and to have families understand is that state law in Michigan requires that instructions from a physician be received in order for school staff to provide care to students, and school staff can only do what is in writing. So without those medical management plans and medication administration authorization forms, school staff cannot provide the appropriate care to students with diabetes or any other health condition. Some of this stuff I'm going to skip over because in the interest of time, and most of this stuff are things that would be included in the training. So if the designated school personnel hasn't received the appropriate level of training, as I mentioned, they cannot provide that level of support to a student. They cannot accept any verbal orders, so not verbal orders from parents or verbal orders from providers. They can't change medication administration, dosages, timing. All of that needs to be provided to the school in writing from the provider, that with a signature from the provider and a signature from the parent. Parents and guardians obviously have to make sure that the plans that the physician or the nurse practitioner write are delivered to the school, along with all of the medications and other supplies and equipment necessary to safely support a student. I'm going to skip through this and go here. So there are a number of items that the school will need in terms of supplies, which I'm sure you're all well aware of, but we'll go through them quickly. The medical management plan should have a picture of your child on it, especially younger children that are not independent in care. The times for checking blood sugar should be clearly identified. The times for administering insulin should be clearly identified. You should encourage your child to wear a medical ID bracelet that identifies type 1 diabetes. And in terms of making sure that schools are adequately prepared to support a student throughout the school day, including unexpected emergencies like lockdowns or evacuations, it's important to have backup supplies, some of which are listed here, available not just in the office, but in the classrooms that your student typically would be in. If your child is carrying all of their supplies with them at all times, then those backup supplies become less important. But if they are not, it's important to make sure that they are placed throughout the school. When a lockdown happens in a school, wherever your child is where they remain throughout that lockdown period. And if they only have supplies that are in the office, that does not help them if they are, say, in the library. So not just the regular classroom, but also in other spaces that they typically would be in. Having said that, I would say that even our youngest children are very capable of learning at a very early age to carry all their supplies with them. And that really is the safest circumstance. A couple of the things that we sometimes get missed in the school setting are backup batteries for technology that are being used. And then for some reason, we often see ketone strips are not provided to the school. So just mentioning those. In terms of the student roles and responsibilities, we always want the student to participate when it's age appropriate in the conversations that are happening about their care at school. We want them to understand how to communicate with adults if they feel like what should be happening is not happening, or they're not being allowed to do what they know they need to do. We want to encourage them, as I mentioned, to carry their supplies, and we work diligently with students to help foster that sense of independence, not because we want school staff not to be involved in their care, but because we know that the sooner a student becomes independent with their care, the safer they're going to be. Even when a child is independent with their diabetes care, school staff should still always be trained at least once a year to know how to support that student in the event that the student needs help, because even the most independent student will run into difficulties and need support of the adults around them. We also want to remind parents to think about the adults outside of teachers that student may be interacting with, and start conversations about training for those people. The ones that stand out the most, coaches. So if your children are involved in extracurricular activities, those coaches need to be minimally trained in emergency response. Bus drivers are another a group of personnel that are sometimes overlooked. So any adult that is in charge of any space that your child is in should have minimal awareness level training. And certainly you should consider requesting that they be trained in how to administer glucagon. So just one last slide on distance learning considerations that Tammy kind of mentioned earlier. Even if you are choosing virtual learning for your child this year, it is important that the schools still have an up-to-date and current diabetes medical management plan, including emergency action plans for your child. It's important that they have completed and updated emergency card information with current phone numbers for you and for your emergency contacts, and that there is an identification of not just your home address, but if your child is going to be receiving instruction in a place other than your home, the address to that location also. And you need to be thinking about what access there is to individuals trained to respond to a potential emergency and what access there is to emergency medications. This, there is no expectation that, especially for our upper elementary, middle, and high school students, that there's going to be an adult in the space that your child is receiving virtual instruction at all times. And so the adults that are interfacing with your child need to minimally be trained to recognize potential signs of a high or a low blood sugar. They need to know to have your phone number in the event that you are not in a space where your child can get your attention if they're running into trouble. They need emergency contacts in the event that you are at work and your child is at an age that he could be home alone, and then the address of where they may be in the event that there's an emergency. If school staff needs to call 911 because there is an emergency and they cannot reach an adult in the home, you want them to have all of the information that they have. The other thing, and I know I've said this a few times, but the other thing that is really exciting to me is that the ease with which the Gvoke HypoPen can be administered is something that somebody through virtual means could instruct even another child to administer in the event that was necessary if there's not an adult there. So making sure access to emergency medications is known to all people that are of an appropriate age in the space where your child would be receiving virtual instruction is important for their safety. And with that, I'm going to turn it over to Jeremy.